Welcome to today's webinar with the Accountable Care Learning Collaborative. My name is Scott Hammer, and I'll be moderating today's call. We're excited about today's presentation, and in particular the opportunity to navigate the ACO database with Tom Merrill. Just a few housekeeping items, as we're accustomed to telling you. To minimize feedback, please mute your line. If you are dialed in, please use your phone's mute feature. If you are using your computer only, click the microphone icon. If you are using both a phone and a computer, it is best to select the telephone option under audio in the GoToWebinar window, then mute your phone. Towards the end, we should have opportunities for questions, so please submit them using the questions box, and we will get to your questions when the time is appropriate. Today, as I mentioned, we're excited to have Tom Merrill with us. Tom is an ACO Research Manager for ACLC. He serves as a lead primary researcher for Leavitt Partners as well, and he's dedicated to understanding the trends and developments relative to the accountable care movement. His responsibilities include managing research relationships with ACO leadership from across the country and combining the qualitative insights from frontline leaders with market and state-level analysis to better understand the evolution of healthcare in the United States. Tom, thank you for joining us, and grateful to have you. And we look forward to you giving us the tour of the ACO database, and I will turn the time over to you, and I will comment as we go, as we talk about what we're going to cover today. So, Tom, the time's yours.
Great. Thank you, Scott, and it's good to be with the ACLC membership again. Many of you I know through my work as the manager for the patient-centeredness work, and so it's good to be with you. Today's agenda can be roughly divided into 4 things. 1, just want to give you a quick general update. 2, we'll cover the terms of use, and 3, this is where we'll spend the majority of our time, and that is looking at the database enhancements that have sort of made this webinar necessary. And then 4th, we'll take just a quick review of some of the new resources that have been put on the website. At the core of this webinar, in terms of purpose, is to help make this our website and some of the resources that we've made available as helpful as possible. We really want this to be something that the members look to frequently, and we want to just make sure that you're familiar with some of the new updates. So really quickly, in terms of the general update, this is still just the best. We are happy to tell you that this is just the best ACO information that's available. And believe us, we have been looking for years because our research team is so busy. We would like to stop tracking ACOs, but we can't because we just haven't been able to find a partner who can do this as well as we do, so we continue to do it, and we hope that you'll benefit from that as well. And it's getting better. The ACO information is getting better. This, as you all know, this is an evolving landscape, and so our policy and research team is constantly working with our data collection team. There's a lot of overlap. I'm also on both teams, and we are constantly modifying the way that we collect data so that it's most beneficial to our research team and to you as well. So we just wanted to just assure you that we're continuing to make this better, and we hope that you'll find it useful. Terms of use. So now in this moment, I'm going to go to the website, and just to remind you that if you were to summarize our terms of use in a sentence, it would be help us protect the exclusivity of this information. We want to make this available to you for your uses, and we hope that we can help keep it exclusive. So hopefully you are seeing my screen right now, and here's the website. I'm already logged in. If you aren't logged in, it'll say login right here, and you can join. But where we are going to spend the majority of our time is under this members only section. So you go down to ACO database. We will be reviewing these other sections later, but ACO database. So here's a short description of the database, what it includes, and what I wanted to point to right now is the ACO database terms of use. And we won't read this, but I will invite you to, if you have any questions, go to this first. In terms of your use, it basically boils down to if it's internal to your organization, please use it and make lots of good use out of it. Outside of your organization, probably not, but shoot us an email and we can have that discussion. So let's go back to the ACO database. So, which is the third portion of our webinar and where we'll spend most of our time. So as I mentioned earlier, our policy and research team and our data collection team work very closely together. And a few months ago, our policy and research team had some suggestions for some changes in some of the data fields, and these changes create a lot of downstream effects on what what the members would see here. In fact, for those of you who use this website quite a bit in the database, you will have noticed this sign here that's been there for a while, and that is we have recently made some changes and improvements. And if you want the most up-to-date data, it won't be displayed here. And so you've kind of been pushed to this download button to where you could just download the spreadsheet. We'll talk about that in a minute. But anyway, we're excited to share with you that the data enhancements that we made a little while back on our back end with the data collection team have now made their way to the website here. And so you'll be able to see that displayed, and but also get those changes and enhanced data in the download. So let's start first with this page that you come to. This is what you call the list view. So you are in the ACO database. You come to the list view. By default, it is is organized alphabetically, right? And so this is where the first set of changes has come into play. The name. The name, the state, these variables that sort of act as organizers in this view have remained the same. But these two last ones, if you can see where my mouse is pointing, the contract type and the Medicare programs, these are different. So, for example, the contract type used to be government, commercial, or a combination of both, government and commercial. And our internal research team really felt like that was not the best way to organize things, just because sometimes you want to see at a glance more specificity than government and commercial. Is it Medicare and commercial, or is it Medicaid and commercial? So we've made those changes, and it now reads, you now have 4 different, well actually it's more than that, it's a variety of combinations. You can have it display whether the contract type for which qualify this ACO to even be in this database is Medicare only, Medicaid only, commercial only, or a combination of the 3. So you just scroll down a little bit and notice that the Accountable Care Coalition of DeKalb has both a Medicare and a commercial contract, and some of these guys have a combination of all 3. So that you can see at a glance. The Medicare program replaces what was formerly the public program. So changing that to be a little bit more specific allowed us to be a little bit more specific over here and change this to just Medicare. Because if it said Medicaid, you know that it's Medicaid in the states in which they reside, and that detail is in the individual ACO profile. So this freed us up to sort of say just Medicare programs, and as you can just take a quick glance, you'll see that it specifies whether it's the MSSP, the next gen, or if you go to another page, maybe you'll see some more variety. Pioneer, no variety on that page, but you get the idea. Oncology care model, there's a good example. So let's go back to the list view. So the other thing that we should just point out is that you can sort from these. So for those who are familiar with this, nothing has changed here, but those who are viewing this for the first time, you can sort, and you'll get, depending on where you are in the website, not sure what's going on there, but depending on where you are in the website, it'll bunch the pioneers, the MSSPs, or the oncology care models together. The other thing that I wanted to just sort of clarify is that there's this neat little, search functionality, but also just sort of note that this is what we call a light search. This does not search the individual ACO profile. So if you want to search for Wheaton Franciscan ACO and you can only remember the name of their ACO director. You can't put in, Cheryl Smith and expect it to show up in the search. You can just, it'll only search these high-level data points. So you can put in Wheaton Franciscan, and if you weren't on this page, it would bring it up.
So Tom, does that mean that you can only search this by name of the system, or is it can you search by category? Maybe clarify that just a little bit.
No, thank you. So
more.
you could search by provider type, and if you, not a very helpful search,
right.
But if you
exactly.
search hospital system, it would bring up all the hospital systems.
But you can't search for the information that's actually found inside one of these one of these accounts, right? You can only search what's on the list page here.
Yep.
Right? Okay.
And so, which brings up sort of my next point, and that is the download button. So I think the majority of the groups that really use this information extensively aren't using, these things like the light search and the sorting. If they're doing, intense market research, they're coming to this page and they're coming straight to this little button right here, the download button. And we wanted to make that really obvious. So groups that have, business intelligence platforms, we've built CSV files that you can just simply click on that. And depending on what browser you have, this is Safari, which I don't use very frequently. That'll download and it'll pop up in your download folder. So
that's great.
So let's go to the map view now. So this is a list view, and the other thing that I didn't point out is that you can change it to see a whole bunch at one time. So I had it on 25 as default, but you can go to 100 and just sort of scroll down and look for groups that sort of match your criteria. But the map view is also another way to sort of look at this, and the way that we sometimes use it is, say for example, the other day I was in California and I was in Southern California and I was in Pasadena, and so rather than go through and do more high-tech search, I just wanted to be able to sort of give a shout out to some of the ACOs that were just in the neighborhood, right? So I was in Pasadena and I could just go through and say, who's nearby? We have Allied Physicians ACO, we have the APCN ACO, and I can even see, what kind of contracts they represent. So both these are Medicare, and then we have the Huntington Memorial Hospital ACO, which has Medicare and commercial. So even in just a speech that I gave here, I could give a shout out to 3 ACOs that were just in the vicinity.
Hey Tom, we have a question that came in that it actually doesn't have to do with the map view that we're looking at here, but it asks, is there one browser that's better than the other when looking at this database, right? So you're looking at it through Firefox. Is it best to look through Firefox or Internet Explorer, or?
Yeah, and I'm actually on Safari in the moment. So
you're on Safari. Okay.
Ideally, it's optimized for all. I use Firefox because of a research plugin specifically, but I would say that it's optimized for Internet Explorer and Safari, and it does pretty well in Firefox, but it's not like it won't work in all of them. And a lot of our other researchers use Chrome as well, so you should be fine on all of them.
Terrific. Thank you.
Great question. So back to the map view. If I'm here, I can click on, I can go straight to the actual profile of that ACO if I wanted to learn more than just, their name. And here I'm going to stop that actually before we go to the actual profile view. We'll jump in a minute, but I wanted to show how, we talked earlier about how public programs, that specific data point was modified to be Medicare. It was the government commercial and commercial categorization, how that changed to be, from 3 different categories to possibly, I think there's 7 different categories, and that is now reflected in the map. So when you zoom out and you see multiple, what used to be 3 colors, so for those of you who use this, more frequently, what used to be 3 colors is now 7 colors. And so maybe a little bit easier in terms of finding groups that you just want to go to specifically. I only want to see groups with all 3 contracts. Those are the dark greens, and so that's pretty easy to just sort of visually scan now.
Tom, we have one other question that came in, and it says, are the locations based on the ACO office listed with CMS or the actual provider network? So I guess the listings that we have, what...
Yeah, so this allows me to clarify a couple things, actually. One, this database is way more than just the Medicare ACOs. So in situations where an ACO in this database isn't even in the Medicare program, it's going to have to be different than that because there's not that information. But yes, the simplest answer to the question is, if it's a Medicare ACO, what do we use to pinpoint the ACO for the purposes of this map? And unless our researchers have found a different reason or a reason to display it differently, it's going to line up with the information that Medicare has.
Great, thank you.
So, and obviously we have to reduce a little bit because you have an ACO, for example, an ACO like Intermountain in Utah, who is one of the major ACOs in the Utah Medicaid ACO program. Their headquarters is going to show up in Salt Lake, but we know that by virtue of the Medicaid program that they're actually, it's not their entire market. They're in specific counties in accordance with the Utah Medicaid ACO program. That can't be displayed very well here, right? So they get a pinpoint in Salt Lake City, and I have to dig deeper to truly understand what the market is. And the best way to do that is just to dive in and look at an ACO profile.
Yep, makes a lot of sense. Thanks, Tom.
So let's do that now. Let's jump in and look at a group like we'll go to Atrius Health. So a very well-known pioneer ACO. In fact, they were recently in the news because they are now they just completed the 3rd year of the pioneer, and they're a fantastic example of an organization that, even though in their first year they didn't create savings, right? And here's their results. We'll get to these in a minute. They have improved every year to finally now in their 3rd year created a bit of savings, or created quite a bit of savings, I should say. So let's start at the top and just kind of quickly go through this profile and see and just sort of cover some of these things that you're seeing here. So one thing I should point out is that my version that we're looking at is the premium database, but the standard database will not have all this information. So just sort of keep that in mind. If you're a user that felt like you didn't need all that information, this will be a little bit more than you're used to seeing. But at the very top, we have an ACO description. And actually what we should have said at the beginning of this webinar, Scott, is that some of these enhancements are so new that they haven't even been completely pushed out, and so we're dealing with, you've already seen a couple of glitches, one of which I should call out is that the ACO description, because of the database backend, it's truncating the entry at a character limit, which it shouldn't. The ACO description for Atrius Health, it's much longer than this, and that should be pushed out by tomorrow morning. So anyway, we needed it to be live to be able to walk everyone through this, and it is, and so the functionality is there, but some of these information bits will still be updating until tomorrow. But in any case, the ACO description that you see here is our best attempt to just kind of summarize everything we know about that ACO. So you could, obviously these organizations are complex. They live in markets, they have histories, and to truly, for example, if you want to engage one of these organizations, you're going to have to know a lot more than just this ACO description, but this gives you just a nice little summary of who they are in case you're, having to scan 50 different organizations in search of a research partner, project partner, or just someone to do a story on or something like that. So we like to make that available. If you scroll down, then you have sort of this demographic data, and this is where we've also had a few changes that will be reflected here that we've already talked about in the list view. So you have the state, you have the coverage area, which can be different, right? So the state could be, the coverage area could be more than one state, but then you sort of have the headquarters. The provider type refers to whether it's physician, hospital, or both. And so ACREUS is a situation where they are both, and I think they're partnering with the hospital, even though ACREUS is a physician group. But their contract types, they have both Medicare and commercial, and the Medicare program in which they are involved is the Pioneer, so you get a little bit more specificity there. And then you have estimated total lives, and this is, we should clarify, this is ACO lives. So ACREUS, for example, as an organization, sees a lot more patients than this. The last data point that we had on them is that their contracts, they had about 72,000 lives, and I'm pretty sure they actually have more than that now. So on a rolling basis, we are updating these. But then you have the ACO date added. So ACREUS Health has been on our radar for quite a bit. They're a pioneer in the Medicare sense, but they're also a pioneer in the normal sense. So we, in the premium version, we like to list the leadership. That can be really helpful depending on, the kind of research you're doing, just kind of knowing who to connect with there. You'll notice that we don't have emails for these individuals, and the reason is very simple, actually, and that is we have research relationships with these folks, and people use this information for a lot of different reasons, and if they want to call up the ACO and form a relationship themselves, that's great, but we didn't want to open them up to being bombarded with a lot of emails from vendors. If vendors want to make those relationships, we invite you to do so, but we wanted to be careful with the research relationships that we have with them. But here you are. You can see them and see them at all sorts of conferences and get to know them, and these guys have become good friends over the years. So let's jump down to Medicare results. So this is something that has also changed. We used to display these differently, and now these are basically displayed the same way that our research team has them on the back end. So not a very exciting change, but it does sort of concatenate a bunch of different data points into some pretty usable boxes. So you can just at a glance see how did ACREUS do in previous years. Also, something we did is we took out the links. So this used to link to the Medicare results page, but because you can't specifically link to an individual ACO's results, those links really weren't helpful. That information is public on the CMS website, and so we just sort of removed those links. But they're easily findable if you do want to go back to the source. But in any case, this is the same information, and hopefully in a way that's a little bit more digestible for you. So jumping down to providers, these are the providers where, going back to the question the other caller had earlier, if it's a list of providers that, for example, an ACO is provided to CMS by virtue of their participation in the Medicare program, this information will mirror that. If it is an ACO that isn't part of a program, for example, in a Medicaid program or commercial contracts that we track very closely, this will be information that we gleaned on our own through our own research efforts. And so that's the source of that information. Payers, we have also reorganized this just a bit to separate them out by contract. So now you can see ACREUS, they have at least 2 contracts, one with Medicare through the Pioneer program and the number of lives and some other data points associated with that. And then their commercial contract with BCBS in Massachusetts and the number of lives in that contract, and the arrangement type, shared savings and shared risk. So you can see it's a 2-sided contract. And then the last, we don't have this on everyone, but I basically picked ACREUS randomly today, and we do happen to have the name of one of their vendors that specifically they brought on to help with their ACO efforts, and Verisk and Arbormetrics happens to be the 2 vendors that we've been able to decipher is involved in their work. Now, going down a little further, we have some data points that will be especially helpful for those who do more specific market research, and that is the affiliated hospitals, which is different than just the providers. Providers will list everyone, but sometimes people just want to see the affiliated hospitals separated out. And then the hospital referral region, which is and the metropolitan area, which is great for different types of analysis. So we make those available to our researchers here and wanted to make them available to you. And I think those would be really useful depending on the kind of work that you do. And then below, we will list the data sources for the information that we've gleaned, which is really helpful, especially when you want to just dive deeper. So you see, okay, from a general sort of high-level data point standpoint, or a high-level data standpoint, these guys match sort of the research that we're doing. But let's go to the articles from which this information was gleaned, and let's dive deeper. And you might find other information there that's helpful. So we wanted to share with you the same data sources that we're pulling from, and depending on the organization, those can be just a few, like Atrius. They have some really good resources that they've made available, and some are from different news outlets. So I think at this point that concludes our portion of just sort of looking at the ACO database in itself, and we'll finish with showing you just a couple of things that we wanted to point out beyond the database, and that is from our resources section. If you go to materials, we recently published the ACLC competency. So this is, as many of you will know who are involved in the different work groups, this is sort of the culmination of almost a year's worth of work. So if you go here, you can click on, for example, if you were a part of or you weren't a part of the governance and culture work group, but you want to see what they came up with, you can bring up their white paper. You can pull up the white paper for each work group to read sort of what their experience was and their conclusions, or you can go to the download competencies for public comment, and this takes you to a page where it explains what we are doing in the public comment period, and you can download that entire spreadsheet with all the associated competencies. So we're really proud of that work that was done. We're proud of, and we're especially grateful to everyone, especially those on the call today that contribute to that, and we hope that you will get on and share this information broadly, and now you know where to go to share it. Oh, and a few things I forgot was the call for collaborative action letter. This is where the same authors of the NAM article that we talked about in other webinars wrote a letter to the industry saying, come and join us in this refinement process and help us continue to improve these competencies, and then a little infographic that is potentially helpful for tweeting and sort of trying to get across the goal of the ACLC in just one visual. So just wanted to call out those new resources for you, and I think I'll turn it back over to Scott now.
Tom, thank you so much. What a terrific resource that ACLC members have in this ACO database, and we hope that you're able to take advantage of it and use it to the purposes that you have in researching and trying to understand what's happening around the ACO landscape across the country. And we're happy to provide this resource to you as members. I just wanted to thank Tom for being with us today. An audio recording of this call will be made available and will be included in our weekly summary. The next webinar will be on Thursday, October 13th at noon Eastern Time on the topic of population health. Joe Mott, Vice President of Population Health at Intermountain Healthcare, will be our guest speaker. If you have any questions about the ACLC or follow-up questions about this webinar, please email us at members@accountablecarelc.org, and we'll be happy to address your questions. Thank you for joining us, and we hope that you found this call to be useful. Bye-bye.
Thanks, guys.